Let's take a look at another look at the serous membranes. Serous membranes are composed of simple squamous epithelial tissue as well as loose areolar connective tissue. The serous membranes around the heart are the visceral and parietal pericardium. The layer directly adhering to the heart is the visceral pericardium. The one on the outermost region is the parietal pericardium. In between the two, we find the pericardial cavity. Keep in mind the heart does not reside inside the pericardial cavity. Certainly the pericardial cavity surrounds the heart or encompasses the heart, but the heart is not directly inside of the pericardial cavity. The heart is not directly inside of the pericardial cavity. Inside the pericardial cavity is going to be pericardial fluid, which is going to create the surface tension to cause the visceral and parietal layers to stick together. Here we have the lungs. In purple are the lungs, and we have the serous membranes around the lungs. Directly adhering to the lung is the visceral pleura. On the outside is the parietal pleura. Between the two is the pleural cavity filled with pleural fluid. And here we see the serous membranes of the abdominal pelvic cavity. Parietal peritoneum is the outermost layer. Visceral peritoneum right here is the innermost layer. And the little space between those two layers is the peritoneal cavity. There are a number of organs like the kidneys, adrenal glands, and pancreas that sit behind all of these membranes. Keep in mind this is posterior where the spinal cord is. This is anterior. So the kidney, adrenal glands, pancreas, maybe a little bit of the duodenum reside posterior to these serous membranes. Hence, they are described as being in the retroperitoneal space. Please be clear, they are still in the abdominal cavity, but in the retroperitoneal space.